The Labour Party stunned political observers over the summer by coming up with a Brexit policy regarding transition that was, at the very least, semi-coherent, even if it completely contradicts their policies of the last 12 months. To talk about that now, we're joined from Leicester by the Shadow Health Secretary, Jon Ashworth. Mr Ashworth, many thanks for being with us. Good morning to you.
Good morning.
Just to be on the safe side, just to be absolutely clear, can you just tell us what the Labour Party's position on Brexit is this week?
I think it's a very mischievous way of putting the question on your first day in the new job now. But let me be clear. Look, we accept Brexit. Obviously we campaign to remain in the European Union, but we accept what the British people voted for, which is why before the general election we voted to trigger the Article 50 to begin the negotiations. But we've always said we want a Brexit deal which puts jobs, puts prosperity, puts people's livelihoods first, which is why we've been calling for these transitional arrangements, which is why we're pressing the government to put in place measures that support jobs and prosperity. So we haven't shifted our position. We always accept that the British people have voted for Brexit, but that doesn't mean we have to give carte blanche to the government. It means that we need to speak out for people's livelihoods and people's businesses and for people's jobs here in constituencies like my own of Leicester South.
Come on, Mr Ashworth. Let's talk about this transitional agreement that many saw as a victory for Sir Keir Starmer over the leadership, in which he insisted there should be a transitional period during which you remain in the customs union and in the single market. However, John McDonnell, June the 11th, I think people will interpret membership of the single market as not respecting that referendum. Emily Thornberry, we're leaving the European Union, that means we need to leave the single market. Jeremy Corbyn asked to be categorically clear if we're leaving the single market. He said yes. Are we sure this policy is going to last?
Well, of course the policy is going to last, and there isn't any big differences here. We've always said from the day of the referendum result that our red lines were about jobs, that our red lines were about living standards in this country.
You also said that we weren't going to be in the single market.
Cliff edge but also trundling towards a cliff edge, as the government are taking towards, is not in the interests of businesses. It's not in the interests of jobs and prosperity of the British people. That is why we have called for transitional arrangements. Part of the reason, by the way, why we need these transitional arrangements is because the government have wasted months and months and months in the negotiation period. The government started negotiations, then called a general election for partisan interest and not the national interest. Part of the reason the government's negotiations are so behind now is because of their party politicking back in May and June, which came back to bite them on the backside quite severely. So look, we've always said we want to do what is in the interests of British jobs and the economy, and we believe a transitional arrangement is putting the interests of the economy first.
I mean, you mentioned party politicking there. I mean, there's a point of principle at stake in all of this. I mean, Jeremy Corbyn, he's been fighting against the European Union for years. Ever since the referendum, he's been saying he respects the result, will be outside the single market, free movement will come to an end. I mean, now he's got the merest sniff of power after the general election. He's pulled a screeching U-turn. I thought he was a man of principle.
Well, I think it is an entirely principled position to put the needs of the economy first.
It's a different principled position to the one that he previously adopted.
No. You can accept that the United Kingdom is leaving the European Union. You can accept the result of the referendum. You can accept that negotiations have to begin with the European Union, which is why we triggered Article 50. But you can equally argue that you need to put in place measures, in this case the transitional arrangements, to ensure that our economy is not adversely affected. I don't think the two positions are contrary. I think the two positions are complementary, and I think it is the principled thing to put the economy first in this situation.
We were given a clue as to where all of this might be heading by the Deputy Leader, Tom Watson. He said that staying inside the single market could be a permanent outcome. Is that the case?
No, I don't think that is the case. I mean, obviously we are leaving the European Union, but what we've always argued for is a deal with the European Union that allows what we call frictionless trade, which allows companies here in Leicester to carry on exporting to the European Union, allows the movement of goods across borders. Because if we bring up barriers, that is going to affect our prosperity as a nation. But it's also going to affect our public services. Over 100,000 people from the European Union work within the National Health Service or in the social care sector. I'm very concerned that unless we get a deal to allow people who work in the NHS and the social care sector to remain in the United Kingdom and allow the NHS to continue to recruit, then the NHS will be severely affected. I suspect in a few moments you'll ask me about staffing issues in the NHS. We're 40,000 nurses short in the NHS. It's having an impact on care at the front line, which is, of course, why we are calling for the public sector pay cap to be lifted this Wednesday. And I hope Conservative MPs vote with us when we bring that motion to the House of Commons on Wednesday. OK, Mr Ashworth, you're speaking to us from Leicester, where admittedly the EU referendum vote was marginal, but across Leicestershire, people there voted, massively in favour of exiting the European Union. Now you're telling them that we will leave the European Union in 2019, but at that point there won't be any more control over immigration, there won't be any chance to negotiate any new trade deals for years. I mean, are you telling me that that's what you think, that Labour-supporting Leave voters believed that they were going to get from the Labour Party? Well, in the city of Leicester, my Leicester South constituency voted to remain. We certainly saw that on the referendum evening. But look, we are not blocking Brexit. Brexit is going to go ahead. The British people voted for Brexit, but what we are trying to do is get a deal which safeguards jobs and the economy. And by the way, I also remember very prominent members of this Conservative cabinet telling us we're going to have £350 million a week for the National Health Service. Now, just last week, the head of hospital trusts said that this winter is going to be very severe and that they need an extra £350 million injected into the NHS to avoid a very severe winter like the one we've just had. And yet we're not getting an extra penny piece for the NHS. Well, let's conclude, shall we, by talking about public sector pay. The Shadow Chancellor, John McDonnell, is down in Brighton today lending his support to calls for strike action. Are we nearing the point where more coordinated strike action is required? I mean, would the Labour Party stand in support of a general strike? I hope not, because I believe that when we have a strike, it's a sign of failure. What the government needs to do is understand the concerns of the people who work in our National Health Service and the wider public services and get rid of this pay cap. We keep getting briefings in newspapers and suggestions that the government is sympathetic and wants to do something and, it's terrible, they accept that, but, let's see where we get to. Well, we're bringing a vote to the House of Commons on Wednesday, and those Conservative members of Parliament who have sincerely said they believe the pay cap should go, we're calling on them to vote with us, and I'm calling on your viewers to lobby those Conservative members of Parliament and let me know what they say. But we can put an end to the pay cap on Wednesday for the NHS staff if they vote with us. On that point of principle, very briefly, Mr Ashworth, would the Labour Party stand in support of a general strike if that was what the unions wished, called for and achieved? Well, people go on strike for industrial reasons. They don't go on strike for political reasons. And obviously, if people take industrial action, then the Labour Party supports people who take industrial action. But we don't want it to get to that stage. We don't want to see a strike. We don't want to see nurses going on strike and wider public servants going on strike. And the way to avoid that is for the government to understand the concerns of public sector workers and get rid of this unfair pay cap. We've got huge staffing problems in the NHS. We've got nurses leaving the NHS, and we're 40,000 short of nurses. We are short of 3,500 midwives. We're short of GPs. The government have to give the NHS a fair pay rise. They can't carry on asking NHS staff to do more and more on less and less. Jon Ashworth, many thanks for joining us. We appreciate it.